This presentation will focus on ventilator-associated pneumonia and the VAP bundle, which is implemented in order to prevent ventilator-associated pneumonia in the ICU. Ventilator-associated pneumonia is a major contributor to morbidity and mortality in the intensive care unit. The VAP bundle was described as evidence-based interventions that will help prevent VAP. These interventions include elevating the head of the bed, providing oral hygiene care, prophylaxis of DVT and gastrointestinal bleeding, and daily sedation vacations with assessment of readiness to extubate. Studies have found that patients receiving mechanical ventilation who are kept in a semi-recumbent position of 45 degrees are less likely to develop nosocomial pneumonia when compared to those patients who were kept in a supine position. This was found to be especially true for patients who received enteral feedings, as this position would prevent aspiration pneumonia. Providing oral hygiene care is another intervention that is part of the VAP bundle. The oropharynx is colonized with potential pathogens that can lead to VAP. Within 48 hours after a patient is admitted to the ICU, the flora of the oral cavity undergoes a transformation to predominantly gram-negative microbes. Oral hygiene care methods such as mouthwashes, gel, toothbrush, or combination techniques have been used to combat these possibly pathogenic flora. One study has also found that the use of chlorhexidine reduced the rate of VAP in patients who did not have pneumonia at baseline. Complications that can arise from the use of mechanical ventilation include DVT or deep vein thrombosis and peptic or stress ulcer disease. DVT can be a complication of mechanical ventilation due to increased venous stasis in the lower extremities. Stress ulcer prophylaxis in patients being treated with mechanical ventilation may be important for the prevention of GI bleeding and further complications from mechanical ventilation. The last intervention that is part of the VAP bundle is daily sedation vacations and assessment for readiness to extubate. Sedation is usually given to patients who are on mechanical ventilations in order to prevent the patient from fighting the ventilator. Early extubation has been found may decrease the incidence of VAP. Therefore, taking vacations from these sedation periods allows for proper assessment of the patient's readiness to be extubated. One study has also found that patients who received daily interruption of sedative drug infusions had decreased number of mechanical ventilator days, as well as decreased length of stay in the ICU. As nurses, we need to be aware of the relevance of the VAP bundle. We need to be aware of the interventions that are required in order to prevent VAP, but also we need to be aware of the scientific evidence that is behind these interventions. We need to be able to understand why we are doing these interventions and why they are so important for our patients. Also, nurses are always the patient's advocate. Therefore, knowing the importance of such interventions assures that we make sure that these interventions are part of our patients' care plans.